health is a big issue for Scotland, but we need the data to see beyond the stereotypes and to really understand what's going on. We need high quality evidence to see where things are improving and where action is still needed, so that the government and the NHS can focus their efforts in the right places. These reports don't just sit on a shelf in the Minister's office. Lots of recent legislation have drawn on data from the survey. For example, the bills to improve school meals and to tackle problem drinking, while the strategy to reduce obesity relies upon the height and weight measurements in the survey. We can't get this data from the NHS. GPs simply don't have enough time to ask people detailed questions about their physical activity or their fruit and veg consumption, so it's imperative that we collect this information from a survey.
The Scottish Health Survey is really important because it enables us to collect information on risk factors for common conditions that affect a lot of people in Scotland, such as heart disease, diabetes and cancer. We can use this information to advise people how to reduce their risk or even offer drug prescription if appropriate. For example, GPs use information collected in the survey to help assess people's risk of heart disease and can then offer them treatment with a statin if appropriate. We can't get this information from normal health service records because in general it's ill people that consult their doctor, and we need information from across the whole population to assess the risk of these important conditions.
Through my work as a consultant at Sick Kids, one of the commonest problems I see is asthma, and so I know the impact that this condition can have on children, young people and their families. It is therefore incredibly important that we have a good overall understanding of asthma morbidity in Scotland, and the Scottish Health Survey really is a unique resource in this respect. The questions have been carefully selected to allow us to make meaningful national and international comparisons. So, for example, we ask about the frequency of coughing, breathlessness and wheezing. And as a result of these questions, we now know that asthma affects more people in Scotland than anywhere else in the world.
All health boards in Scotland can access data from the Scottish Health Survey to find out about local populations, but in Fife we have boosted our sample so that we can have access to information to compare areas within Fife. The national picture is useful, but if we want to target our efforts locally, then we need to find out such things as how many Fife residents smoke or how many take regular exercise. We used to run surveys locally, but we know that the Scottish Health Surveys have a very high quality and we want to take advantage of that. One of the surprising things we have found out about Fife residents from the Scottish Health Survey is the low proportion consuming 5 daily portions of fruit and vegetables, despite this being a long-standing and consistent health message. As a result, we are going to review this further in 2012.
If participants give their permission, their responses to the Scottish Health Survey can be linked to their health records. This means that we can look at how a range of factors from the survey influences their chances of developing a particular disease, or of needing surgery, or of dying.
In fact, very few countries in the world have this kind of information, and it attracts a lot of interest. So, for instance, I was in Copenhagen last month and I was presenting findings based on the linked health survey and health record data, looking at diet and other aspects of lifestyle in relation to the development of heart disease over time.
Because we follow up people over the rest of their lives, the information accumulates. New respondents are added every year, but through record linkage, we're still following up the people who were first interviewed in 1995.
We'd be extremely limited if we were only able to use data collected by the NHS. And the great thing about the Scottish Health Survey is that we can combine survey answers and health data, so it's not just a case of one or the other. The survey provides a breadth of information not available from the NHS, and we can combine the health record and the death data, and that completes the picture.
Charities like the British Heart Foundation Scotland use the Scottish Health Survey data extensively. For example, it's our aim to cut premature mortality from heart disease right across the UK, as well as to improve outcomes for people who've had a heart attack and to reverse the rise in childhood obesity. It's really important that we get access to high quality information in order for us to decide how to prioritise these issues. It is particularly useful for us to get information provided by the Health Survey on height, weight and blood pressure, because that's just not provided routinely anywhere else within the NHS. We really value the contribution of the Health Survey to our work, and particularly the contribution made by researchers in the field.